Okay, so what are some of the things that could possibly go wrong? We probably all have heard of shock. So what shock is simply inadequate cardiac output, and it can be for a number of different reasons. So essentially, there's not enough cardiac output, which means there's inadequate perfusion, so not enough blood getting to the cells of a body organ. Cells are forced to switch to anaerobic respiration. Lactic acid builds up. Cells and tissue become damaged and die. Okay, so types of shock, reasons why we would not have adequate cardiac output. There's hypovolemic shock. Simply we don't have enough blood volume, so low blood volume. There's cardiogenic shock. The heart is simply not functioning correctly. There's vascular shock, so inappropriate vasodilation. So sometimes if all the blood vessels in the body vasodilate at one time, the resistance drops so low that the mean arterial pressure drops so low that we go into shock. Or obstructive shock is simply there's an obstruction of blood flow. Like there's a clot there, or some reason blood is not getting to that body part. So this would be something that you might see like in a cardiac arrest kind of thing. So mechanisms that help compensate. There's a renin-angiotensin-aldosterone system. Again, the antidiuretic hormone that we saw, the sympathetic nervous system becomes activated, as well as local vasodilators may be released. So, for example, nitric oxide in the body. But obviously, some of these can only compensate so much. I mean, if you have a missing limb or a severely damaged artery, these are not going to be enough to simply fix that. We've all heard of hypertension. There's primary versus secondary hypertension. Primary hypertension is what most people have, and it cannot be attributed to any one particular organic cause. So that'll make more sense if you look at secondary hypertension. So that's a very clear underlying cause, such as kidney problems, too much aldosterone, too much epinephrine or norepinephrine. That's very easy to understand why you have high blood pressure in one of those cases. Primary hypertension is a little bit more vague, and so that's why treatment can be difficult as well. You don't have to memorize this chart. It's just there for your information. So how do you help with hypertension? Well, again, we mentioned that, so these are all the things that are going to help reduce our mean arterial pressure. So things like losing weight. So again, by doing that, you decrease the total length of blood vessels, which will decrease resistance, which will decrease mean arterial pressure. Alcohol intake can also affect your blood pressure, how hard the heart has to work at times. Exercising, again, healthier heart will help reduce its cardiac output, which will reduce the mean arterial pressure. As we mentioned, by reabsorbing salt, you will reabsorb water, which will increase your blood volume, which will increase your blood pressure. So by reducing your sodium intake, you will reduce your blood pressure. Smoking will also make your heart have to work harder. So again, that affects your cardiac output, as well as managing stress, so not activating your sympathetic nervous system. And then obviously, if those things do not help, you may have to be put on various medications, such as diuretics, so to reduce blood volume and thereby reducing blood pressure. Beta blockers, these will decrease your cardiac output. Vasodilators, these will decrease blood resistance or blood vessel resistance. And then calcium channel blockers will also reduce your cardiac output. And let me just come back to the alcohol, and I apologize, I don't think I said this correctly. I just want to make sure you understand. So alcohol is also going to cause vasoconstriction, which will then increase our blood vessel resistance, increasing our blood pressure. Syncope is sudden fainting or loss of consciousness, not due to a trauma. So this is not because you got hit in the head by something. Some other reason, there's a loss of consciousness. Usually it's due to a lack of blood flow to the brain. So one example is called vasodepressor or situational syncope. This is due to sudden emotional stress. pressure stress of coughing, defecating, or urinating. This actually is how Elvis Presley passed away, by bearing down, trying to, poop, essentially, caused a increase in pressure in his chest, which then caused him to basically have a heart attack and die in that case. So it was very dangerous. But I believe the EMT crew called it the commode code. It is more common than you would want it to be. But any of these things can cause a sudden, decrease in blood flow to the brain and then person passing out. Usually it's when they're kind of holding their breath and bearing down. There are some drugs that can reduce blood pressure too much, so antihypertensives, diuretics, vasodilators, obviously tranquilizers, right? There's orthostatic hypotension. Our body is very good most of the time at knowing to increase our blood pressure going to our brain when we decide we want to stand up, right? We know we want to stand up. There's parts of the brain that communicate with one another, so you automatically will adjust your blood pressure knowing that you are now going to be moving from a sitting to a standing position. Ever so often, however, that timing is a bit off, and I'm sure we've all had that experience where you suddenly stand up real fast and you're lightheaded for a moment. So that's orthostatic hypotension. And I'm kind of a big Star Trek nerd, so I couldn't help but bring in the Vulcan nerve pinch. And if you guys are not familiar with that, I feel a little sad, but so this is Mr. Spock, and he's a Vulcan, and he is delivering a Vulcan nerve pinch. You'll notice it's at the neck, at the base of the neck of this individual. In fact, it's not all that crazy. So remember, we have those baroreceptors in the carotid sinus, right? So in the neck. And interestingly enough, if you massage those baroreceptors, what happens, you put pressure on them, what they think is that there's too much blood pressure going to the brain, right? Because you're causing vasoconstriction, which increases vascular resistance, which increases blood pressure. So by massaging the baroreceptors in the neck, you can actually stimulate your heart rate to decrease, right? But if you do it too much, increase too much pressure, right? They'll send signals to the heart to decrease too much. So when you let go, it would cause the person to pass out. So that's the idea behind the Vulcan nerve pinch. But actually, doctors use that baroreceptor massage to help decrease patients' heart rate sometimes. All right, so what can you look forward to as you get older? Oh, so many good things. All right, so one of them you'll see is a decreased compliance of the aorta, meaning that the elastic fibers in the aorta no longer stretch like they once did, not unlike a pair of old socks, where elastic kind of goes after age. Similarly, the aorta won't stretch anymore. This, unfortunately, does make it more susceptible to rupture, which is very, very dangerous, but it does happen. There's reduction in the cardiac muscle and fiber size, kind of like all the muscles in the body kind of start atrophying, which reduces cardiac output, maximum heart rate, an increase in systolic pressure. So it's usually due to plaque buildup. So it makes the heart work a little bit harder. Unfortunately, the bad cholesterol increases, the good cholesterol decreases, and all these different, which then can lead to things like heart failure, coronary artery disease, and again, that plaque buildup. So things you get to look forward to. So it's really important that you try to keep a healthy heart as you're young. All right, that's about it for this section. If you have any questions, let me know.